Well, the reality on ground concerning vaccination there in Edo State. Well, joining us to talk more about this and stopping the spread of the fourth wave, Dr. Dafet Olugboge is the public health physician. He joins us for more on the program. Thank you for joining us and Happy New Year to you. I'd like to begin. You headed the NMA, the Nigeria Medical Association Lagos Task Force on COVID-19 in 2021. What did you discover in Lagos? And this is in terms of, the operations under the pandemic.
Thank you very much, and Happy New Year to you as well. And thank you for having me on the program this evening. Well, heading the task force for the Nigerian Medical Association opened my eyes and the eyes of so many of my colleagues to so many problems with our health sector. First of all, the Lagos State government, led by Mr. Governor and then the Honorable Commissioner for Health, did and are doing wonderful jobs to ensure that the fight against COVID-19 pandemic in Nigeria and in Lagos by extension is top-notch. Save for their efforts, I'm sure we wouldn't have been where we are right now. We had a lot of issues in Lagos and by extension Nigeria concerning COVID-19 fight, but Lagos was able to surmount. But I think one of the major problems that we encountered or are encountering in Lagos and indeed in Nigeria is the apathy from the general public, the skepticism from the general public, the rumor mongering from the general public, which have created a lot of stumbling blocks to health workers, to planners, to policymakers, to other people in the general public who may want to assess testing, who may want to assess care of COVID-19, and who may also want to assess the vaccination for COVID-19. So these have been the major problem. Then the healthcare system also was not prepared for the calamities and the mortalities and the mobilities that accompany COVID-19. So the healthcare system was overwhelmed during the pandemic, the peak of the pandemic. So the government needs to prepare forthwith for such pandemics, for such emergencies in the nearest future. The general public also needs to be aware. People like us and a host of colleagues have been creating awareness on the TV, on social media, everywhere we care to, we have the opportunity to do so. But a lot of people are still skeptical as to what we tell them. They still don't believe what we tell them. They still don't believe what they are seeing. In one of those clips that you were showing, there was a lady, one of the vaccinators, that was complaining bitterly as to why people were not turning up to get vaccinated. A lot of people were not turning up because they believe that the vaccines are detrimental to their health. So this is one of the issues, religious, ethnic, so many other issues that you can think of that is beguiling our fight against COVID-19 in Nigeria.
Dr. Olugboge, perhaps another question also is, how much are we really seeing? I mean, today someone asked me that these numbers we're reeling out. Last night, Lagos took the highest. Where are they? Who are they? Do they really exist? So if we're hearing that Omicron is driving or appears to be driving the increased hospitalizations, are we seeing the isolation centers? What are they looking like? Or is it home care? How much are people getting to convince them of the existence?
Yes, the numbers and the figures you are seeing, they are not fictitious. They are real numbers. And don't forget that in the middle of November or at the beginning of November, we predicted that the number of cases, the number of people who were going to get infected were going to rise up during the Yuletide. And that's because the Omicron variant and the Delta variant were rife at that particular point in time. So people would naturally get infected because they party more, because they travel more, because they engage in large gatherings and social gatherings more. So we are in the fourth wave now. So the figures you are seeing are not fictitious at all. They are real. The human beings, the people who contract these viruses, this virus, are real. And all over the world, according to the pattern of what we have all over the world, the number of people who are getting infected with the Omicron and even the Delta variant are on the increase in Europe, in Britain, in America, even in Nigeria. The same story applies. So the isolation centers, there are people there now. There are we are having an increased number of people who seek health care as the day goes on, as the day rolls by, because of the increment in the number of people who get infected with the Omicron variant. And don't forget that at the beginning, we predicted that the Omicron variant will be very, very infectious, far more infectious than the Delta variant. So it is natural that there are increased number of people who get infected, and then as a resultant effect of that, there are increased number of people who would naturally seek healthcare services. So the numbers that you're seeing are real numbers. In fact, I dare to say that if we test more, we will find far more than this in the community. So there are people in the community who get this Omicron, but do not seek healthcare and are taking care of themselves at home, are doing home care in the houses. Yeah, somebody tweeted on social media a couple of weeks ago that some people who come down with malaria or who come down with flu or think that they fall sick during the December period actually had or might have had Omicron. Well, because they didn't get tested, they didn't know or they didn't think it was Omicron that they had. But most of the people who had flu around that period or who are having flu around this period are actually having Omicron COVID-19 viral infection. But because they are not getting tested, I don't know of it.
And even to, verify if it's Omicron, it would have to be genomic sequencing, and that is not necessarily easily accessible. I mean, the RDTs can detect if it's Omicron or not, is it?
Yes, absolutely. It is one of our shortcomings in this part of the world. If we had the rapid test kit, which I just saw that you televised, that are being used at the Aso Rock Villa, if we had enough of it, a lot of people can, get tested on the go and then know their status as it is. But then again, a lot of people do not have access to this. They have to rely on the PCR testing, which is a bit expensive for them and maybe a bit out of their way. So if you have the rapid test kit for testing, we may be able to pick up more tests, more people testing positive for the Omicron variant.
So essentially expanding the strategy in testing. We'd like to thank you so much, Dr. Japhet Olugbogey, a public health physician. Thank you so much for sharing your time with us on this issue.
Thank you very much for having me on the show.